Depression is a common mental disorder and one of the leading causes of disability worldwide. It affected more than 300 million people globally across all ages, mainly characterized by the lack of noradrenaline and serotonin. Due to the fast reuptake or the decrease of noradrenaline and serotonin monomers on the synapses, it affected the mood, insomnia, anorexia, difficulty in concentration, and suicidal thoughts. Antidepressants belongs to a group of limited pharmacological resources that can be used to treat neuropathic pain. The two groups will be SSRI and TCA. How our antidepressants are used? It can be used in both genders and safe to use above young adults if it is approved by FDA, EMA, TGA. Depression can also be tested using the method of Beck Depression Inventory, Hamilton Rating Scale of Depressions, treat neuropathic pain by inhibiting one of the serotonin receptors.
The Hamilton Depressing Rating Scale of 0 to 7 is normal and greater than 23 is very severe depression, whereas Beck Depression Inventory Scale of 1 to 10 is normal and greater than 40 is extreme depression. For the clinical use, gender is one factor that can affect remission rate, but age, literacy, and gender has no impact on the rate of lowering depression. If a patient took antidepressant previously, has a history of bipolar disorder, schizophrenia, pregnant, unresponsive to checkup, and major depressive order with psychotic features will be excluded from the data.
That shows the clinical use of nortriptyline versus fluoxetine. It's a double-blind randomized clinical trial with 6 months follow-up period using Beck Depression Inventory Score, shown on the table below. Table 1 shows equal ratio of male to female in nortriptyline versus fluoxetine group. They have a mean depression score of 32 to 33, which is severe depression. Table 2 and Table 3 shows nortriptyline and fluoxetine usage after 3 and 6 months. Fluoxetine has a lower Beck Depression Inventory Score compared to nortriptyline, as you can see from the table below, even though consuming more nortriptyline and less fluoxetine. This means that fluoxetine is more useful as an SSRI compared to nortriptyline. Second clinical trial will be the use of ibuprofen versus fluoxetine using forced swimming tests. Mice was used as a subject of the experiment as it shows similar organ structure to humans. Forced swimming test display an immobile posture that is considered to reflect a state of behavioral despair. It is thought to model a kind of depression-like phenotype, namely despair or helplessness. The lower immobility time it is, the less amount of time spent on depression. As we can see from this graph, imipramine and fluoxetine comparison, fluoxetine has the lowest immobility time. This is due to the increased level of tumor necrosis alpha. Tumor necrosis alpha helps to regulate immune cells, which allows recovery. The ability to have faster regulation would mean less stress, less paranoid, less anxious, and therefore less time spent in depression. Anti-inflammatory interleukin-6 is also a factor as well. It is produced by different types of cells when under stress conditions. So it helps to regulate inflammation, autoimmune responses, and regulation. Increased level of autoimmune responses and regulation would mean that you spend less time in depression. Corticosterone level is involved in energy regulation. Increase in level of energy regulation would mean that you spend less time in depression as well. So the increased level of interleukin-6, corticosterone, and TNF-alpha would mean that SSRI would be a better drug compared to TCA.
Based on the two clinical trials, SSRI is the first-line therapy and blocks the reuptake of selective 5-HT, whereas TCA is the second-line therapy and blocks the reuptake of sodium. SSRI has less side effect and high efficacy, and on the other hand, TCA has a very high rate of side effects but high in efficacy.
TCA has more severe side effects than SSRI, such as atropine-like effects. Hence, SSRI is known to be a better depressant than TCA. It responds to severe depression more readily, and that gender is a huge factor for AD effectiveness. Men share to have a better adherence, but are more likely to discontinue to SSRI compared to women. According to research studies, counseling is the best treatment option. To conclude, SSRIs are more effective than TCAs because of the greater tolerability and efficacy, plus less severe side effects.